ideally for an Ayurveda student to start with Ayurveda practice, what needs to be the prerequisite to establish a successful practice? Since Ayurveda is a huge science, including Nadi Parikshana, Prakriti Parikshana, etc., it seems to be challenging enough to the students. Make those students make try to get into the knowledge. When it comes to practical utility, fear creeps into the mind. So as an experienced one in this field, according to you, what are the things the student should take care of so as to dedicate their best in the Ayurveda practice? Fundamentals of Ayurveda practice, where to start, what makes an Ayurveda doctor, sir?
See, if you want to become a successful Ayurveda doctor and to make a name and fame, it requires certain prerequisites. So one of the important prerequisites is when you study Ayurveda in the classes or through gurus or relatives, you need to study it in a real sense, giving all utmost concentration and trying to understand the concepts very clearly. Means you should have the thorough knowledge of the theoretical part of it, the subject. Then comes you should have the practical approach, how to handle the patient, how to take the history, how to analyze the lakshanas, what lakshanas are present with this, and all those concepts can be learned through gurus in colleges or in institutions or gurukula or whatever it is, they are such type of therapeutical centers through which you need to have a thorough knowledge of practical part of the theory. So if you have a strong theory and a practical, definitely, and of course, knowing about the various yogas and their guna, rasaguna, virapa, their falashruti and so many things and their availability, when you start practicing independently, when a patient comes to you, first thing, rogamado parikshetam tadanantaram aushadam. That's the thing what you need to do it. Analyze what the condition is, what the presenting complaints are, and what basically you come out with a baseline that whether it is vata, pitta, kapha or in combination or all the three together, whatever it is. Then how long he is suffering from and what are the other lakshanas being found. Then keep all these with you, then finalize what drug can be given. If you follow these protocols in a peculiar fashion without deviating from this, then definitely there will be successful things. I'll explain you how the people will make you to slip away from the protocol. Recently, I had a patient. She had asthma and she required a virechana, tamaketu virechana. But she doesn't have the number of holidays or leaves. So she asked whether can you concise this process. They want to have virechana, the two classical virechana, but it should be concised. Means you give me treatment wherein the medicine should be sweet. I can't take the bitter principles. So such type of things will make you to deviate. Don't yield to such type of deviations forced by the patients. It is the one who has the liberty to choose the drug is the physician. He is the right person based on so many parameters. He will make the right choice of what drug should be taken. So such type of deviation and pushing you to different things, and many times certain fellow friends who are already started and they're established, they are providing something new things with new names, power Ayurveda, power yoga, something like that. Then always so many things will force you to deviate from the basics. It is just like in the game of cricket, what they say, stick to the basics. So here also stick to the basics. If you stick on to the basics of theory as well as practical, then that knowledge will definitely help you and guide you to the right path, and definitely you will find the success.
One of the early traps that we Ayurveda practitioners get into is like cajoling and giving into the preferences of the patient. So customer is king. That works in some other fields, but in an Ayurveda setup, it should be the Vaidya who takes all the decisions, and with the convincing powers, with the right language, with the right word, convince the patient and then make him to fall in line and do not go overboard to accommodate the patient. And ultimately what matters is principles, processes and protocols. And another point that I observed is that have a case sheet and try to, especially for the budding doctors and of course for all the doctors as well, having a case sheet and filling up how is the Agni, how is the Mala, how is the Nidra, what are the doshas involved. So this kind of methodical approach would help automatically to think, do the Amshamsha Kalpana to break down the disease, and also to do the Rogi Pariksha very elegantly, sir.
See, definitely, this is one criteria when you analyze all these things. In every disease, the very primary concern is, Acharya very clearly says, Mandagni. So you need to improve the Agni of the patient. So try to analyze what sort of Agni he is having, and the Agni is influenced by which dosha and which one. Based on that, what are the Lakshanas are there. So based on that, you can finalize what type of Agni he is having and how to improve that Agni to a right kind of Agni. So then if first thing is, if you improve the Agni, that Agni itself is digest the Ama. And once that Ama is digested, automatically many Lakshanas will subside. Then comes the real drug with choice which you have taken and it can be given. So that's why many a times we always club our preparations in while prescription. Either it will be having Trikato Churna, either it will be having some Chiraka, Ringvasika Churna, or it is having some Aragyavardhini Vati or something like that. So all those things will directly guiding the patient, the body to set a right kind of Agni first, and that will definitely improve the all other factors.
And another point of pain for new Ayurveda doctors is like picking the herbs and picking the right medicines. So start Ayurveda practice with 10 to 20 to 30 Ayurvedic medicines that you already know, and study them in detail, and probable combinations that you can make within them, and start with simple line of treatment for easy to treat diseases which you are already comfortable with, and who in your internship, etc., you have seen such cases. So concentrate on that, and side by side start improving your armory, and start studying about more and more herbs, more and more medicines, and start including more and more medicines into your permutations and combinations. When an Ayurveda doctor starts, he will not be knowing everything on the day one. So it's a practice, and it's a process, continuous process of learning, sir.
Unfortunately, that is due to the substandard colleges and the institution from where the people are getting their degrees and coming out. If you are coming through a standard and a very comparatively quite number of patients are seen, and there will be no deviation from the theoretical knowledge and all those things, then definitely by the time you come out of college, definitely you know much things which can be a basic things for the practice. But all those colleges where there are substandard and even practicals are not held and the patients are not there sufficiently, they are not observe the patients, and even students are also not interested to know about things. They enjoyed their college days, and now suddenly once they come out, then they'll find a problem and they still things. That's the reason we need to be very, very strict in disciplined in utilizing our time during college days. Enjoyment is a part of it, but it should not become the total time. We need to have certain time for studies, proper studies, understanding the concepts, clearing those concepts in your mind very clearly, and then observing those concepts, how it is being applied and the real cases, conditions, and how the improvement are seen. So based on that, it is a pratyaksha pramana. You will come to know that what exactly happening, and it becomes a very clear information for you when you practice independently in future.
And another way probably to fine tune our prescription skills is probably once you prescribe, maybe go back to the textbooks, Asangridam, Charksamhita, Sushta and whatnot, and study the disease, and also study the disease and analyze what else you could have done better. And so that is one way. And also Vaidya Samuho Nisamshaya Karanam, like you have told in many previous episodes. Put it in WhatsApp groups and be open to criticism, and be always learning and ask for opinions, and be humble enough to take positive advice given by the fellow doctors and incorporate. Sir.
Definitely. So many such groups are there. Vaidya Samuha is there. If any case is there and you have done certain basic application or prescription, then keep those conditions and information or data from the history and what your diagnosis, probable diagnosis, and then what is the treatment protocol you are given. If you place it on that thing and ask for the seniors to comment or give guidance, and definitely if any errors are possible errors are there, that can be guided by the seniors, and they'll say add these things or avoid these things, something like that. They give their inputs, and definitely that will improve the everybody's in the group their knowledge and their practice skills.
And another idea for budding Ayurveda practitioners is to ask the request the patient to visit back in a shorter period of maybe 2 to 3 weeks only, so that if there is any fine tuning is to be done, it can be done in the next visit itself. So shorter period, at least in the initial practice, would help to fine tune, sir.
Not only initial practice, in every case, whatever the medicines you give, it should not be in the first sitting, it should not be more than for 15 days. It should be less than 15 days, and then that will be a very ideal one. Then by the 15 days time, then you will have at least some noticeable changes will be there, or anything to be added or deleted or increase the dose or whatever it is can be done after that. So it's initially it should be at 15 days or below 15 days. It should not be more than that.
One Ayurveda practitioner regarding the fear or the courage to do certain treatments and to prescribe certain medicines. Dr. Roshi Joseph, she's my senior from Copa, and she's a PhD professor now. Her father is a very senior practitioner and all, and she was telling me in my Copa days that during younger times her father would take bigger risks and bigger bets and would prescribe aggressive therapies with a lot of courage. But as he aged, that courage decreased, and he went on to prescribe some safer herbs. So courage is also an important aspect of Ayurveda practice, that we have to back our knowledge and do all things that is necessary to cure, give the best possible cure to the patient, sir.
Courage, I cannot take it as a thing which, because simply if you have courage, you don't have a backup of knowledge, then what is the use of that courage? That cannot going to help us. Courage, in better terms, we can keep it as we should know basically when we take up the first case, what is the condition of the doshas in the body, what is the Ana, Agni, and basic line. When you understand this is the thing, and accordingly maybe some laboratory investigations to support our diagnosis or probable correlation things can be done. And once that is done, and the condition is not an emergency one, and is not going to land up in any serious nature of the disease, or it is not further advanced, in such cases, you can courageously use the drugs of your choice based on your judgments. So only in case of emergency type of things which may slip away to the emergency area very sharply or very short time, then the courage is required to handle those type of things. If something goes wrong, how to handle this, what should be conveyed to the patient's relatives, and all those things. And regarding the prognosis, what should be told, and how to take the consent, and what is the methods to be explained, and what probably things may happen. The case may in this type of case, that may be a particular case, and that maybe chances are 50-50. All these things should be very, at that time you need the courage to explain to the patient relative, because the patient relatives will be in a traumatized condition, they will be anxious, and they will be looking for only the result, and their feeling is that we have brought the patient to the doctor, and the doctor is seen and medicine is given, then patient should become normal, operate within a few days or few hours. So if it is not happening, definitely they will start asking what is happening, why it is not happening, or why the results are not seen. So we need to explain them in the initially what the condition is that, and how far we can help, and what may be the total outcome. If they are convinced, then only we can start the treatment. Otherwise, if it is going to be tougher one and something like that, or maybe causing trouble or may end up in problems, better shift the patient or refer the patient to higher centers where people can handle it.
So ultimately, Ayurveda practice is all about learning more, having more experience, and backing what we know, and giving the best to the patients.